Good afternoon everyone. So today I will be talking about the topic Introduction to Minimally Invasive Dentistry. What is Minimally Invasive Dentistry? What are its scope? What are the recent research interest areas? And what can be done in the future directions in the field of Minimally Invasive Dentistry? So coming to the basic concept and the definition, it is a contemporary dental practice approach that seeks to conserve the tooth as much as possible, the natural tooth structure, with effectively managing and preventing the dental diseases, particularly the caries that is involved. So it emphasizes on the use of techniques and tools, materials that require minimal alteration of the healthy tooth structure. This shift in dentistry began early, and it has a broad trend towards patient-centered care, focusing on both the functional and the aesthetic demands of the patients. So coming to the principles of conservation of tooth structure, what are the core principles of MID? What are the basic steps involved in MID? These are like the core principles of preservation in minimally invasive dentistry around preventing disease progression while conserving the tooth structure. Central to this approach is the caries detection methods using advanced diagnostic tools and techniques such as digital imaging use and laser fluorescence, enabling timely and non-invasive intervention. Caries risk assessment also plays an important role for personalized treatment planning, prevention and remineralization over traditional restorative procedure. So what does MID advocate? It advocates for conservative cavity preparation using adhesive materials that bond effectively to the enamel and the dentin, minimizing the need for excessive drilling and filling interventions. What are the techniques? We have the stepwise evacuation, atraumatic restorative technique involved in it, use of sealants and the sealants preferred over the aggressive restoration techniques. The integration of the magnification and the microdentistry tools in this enhance the precision of the caries risk assessment, further supporting tissue preservation. Patient education can play a very big role. Regular monitoring and follow-up along with lifestyle modification will play a crucial role in maintaining the oral health, making MID a holistic approach and biologically respective model of care. So I wanted to mention a study that was published in 2012 in the International Dental Journal. It defines a larger and more precise list of minimally invasive dentistry procedures that involves early caries diagnosis, classification of caries depth and progression, assessment of individual risk, optimal caries preventive measures, remineralization of early lesions, minimum surgical intervention of the caries lesions, repair rather than replace the defective tooth structure, and also assess the disease management outcomes at these levels. So following these steps of the MID, we can have a holistic approach towards caries risk prevention. So coming to the origins, how the history evolved around MID. So the roots of the MID can be traced back to early philosophies with tissue preservation, with a shift towards less destructive approach. In the mid 20th century, they had access to dental materials and understanding of the caries pathology. So these are the areas that we have seen progress over the years of the MID and how it is different from traditional dentistry. So the traditional dentistry involved extensive removal of the tooth structure to eradicate caries, where MID has emerged as a procedure in response to embrace less aggressive methods, prioritizing conservation and patient-centered care. So the main historical milestones in the MID include development of adhesive materials in the 1970s, advent of the air ablation technique in the 1980s, and the implementation of the laser technology in the 1990s, all contributing to the evolution of MID. So coming to the early research and publications, the research in the 1960s and 70s established the foundation for conservative caries removal and the concept of minimal intervention, sparking further intervention. So research has started as early as 1960s in this area. So development of the diagnostic tools, we can see the use of digital radiography, biometric imaging and advanced caries detection devices that are developed to enhance the ability of the lesions that can be identified accurately and early, facilitating minimal invasive treatments. What are the advancements? The advancements in this are the development of the adhesive technology, the development of the durable bonding agents and resin composites that took place in the 1980s and 1990s, revolutionized this dentistry, restorative dentistry per se, enabling conservative restorations with strong adhesion to tooth structure, tissue and structure. The introduction of air ablation techniques was one of the major hallmarks, where it allowed for selective removal of decayed tissue with minimal discomfort and preservation of the healthy structures, complementing the MID principles, so establishing a fact that these go hand in hand. There was an integration of laser dentistry, specifically in the late 20th century, to provide precise, minimal invasive options for soft and hard tissue application procedures that reduce patient discomfort and healing time. So coming to the research areas, I wanted to just incorporate on the fact that the principles of minimally invasive dentistry roles around these. So we have to recognize what is a dental caries, then reduce, then repair, and then go towards regeneration. Recognition is the early assessment of and identification of the patient of the potential risk factors for caries. It may involve some tests like digital scanning and all. A reduction refers the effort to minimize or eliminate the risk factors involved by changing the lifestyle of the patients and modifications. Repair, so if already a cavity is present, caries removal is performed accordingly and conservatively. And regeneration, it aims to arrest or reverse the oral problems by using appropriate biomaterial reagents. So the golden triad that was introduced by Dawson and Markson in 1992, it had a triad of this only, that is, first we have to reduce the rate of the restoration, the replacement. Minimal intervention should be there, prevention should also be there, and remineralization by the bonding agents and the biomaterials that we develop should be there. These properties should be there. So coming to the research areas in MID. So first of all, caries prevention and management. It focuses on the early detection, remineralization strategies and minimally invasive techniques to remove and prevent the progression of caries at a deeper level to preserve the tooth vitality. So restorative techniques can be, these all can be divided into four major things. First is restorative techniques, second is the diagnostic innovations, third is the development of adhesive dentistry, and fourth is the aesthetic and the functional outcomes in which we can see a research progress. So first coming to the restorative techniques, it has two branches, that is the development of the resin composites and preparing the cavity as minimal, so minimal cavity preparations. When it comes to resin composites, they can use aesthetic durable resin materials that bond strongly to the structure, enabling conservative restorations with minimal removal. Minimal cavity preparations aim to remove only the decayed part or the decayed tissue with minimal extension, retaining the maximum tooth structure. And also, when we come to the diagnostic investigations, use of digital imaging and caries detection methods play a very important role. In digital imaging, there comes use of intraoral cameras, 3D imaging techniques, digital radiography for precise diagnosis and treatment planning. In the caries detection method, they use laser fluorescence technology, near-infrared imaging techniques, and other advanced methods for early detection of carious lesions. For adhesive dentistry, we have two types. The research is going in the making of new bonding agents and which will help in tooth preservation. So development of advanced adhesives allows for strong durable bonds to the tooth structures and the tooth tissues with less invasive preparations. And these all all strategize, focus on bonding to the enamel, remaining enamel that is present in the tooth, and tending to reinforce the tooth structure. So the ultimate aim is to have aesthetic functionality and functional outcomes. So all this research ensures restorations are not only durable but also aesthetically pleasing and functionally compatible, contributing to overall patient satisfaction. So coming to the future directions of minimally invasive dentistry, we can have applications at the nanotech level, development of biomimetic materials, and development of minimally invasive periodontal treatments. When we come to nanotech applications, we can utilize nanoparticles in restorative dentistry for developing antimicrobial agents to enhance the strength, bioactivity and durability of the substances that we are synthesizing, so that it helps in the caries removal and also helps in caries risk assessment. Development of biomimetic materials that replicate natural tooth properties, promoting tissue regeneration and integration. And lastly, the minimal invasive periodontal treatments, advances in techniques and devices that allow for the effective periodontal therapy with integration of laser for minimal tissue trauma, aligning with the MIT philosophy. Thank you.